Thank you, Gary, for those welcoming remarks. My name is Belen. I'm the CEO of the National Health IT Collaborative for the Underserved, and it is an honor, truly a privilege to be here with you all today with this summit. The NHIT Virgin Islands Health Innovation Summit, and as Gary said, this has been a 2-year process to bring this about. So I'm going to start, and then I'm going to be joined by Commissioner Gomez. Let me give you a quick background on NHIT. The National Health IT Collaborative for the Underserved was launched in 2008 by the Office of Minority Health, the National Institute of Minority Health and Health Disparities, HIMSS, and about 100 different organizations, and it was all with this quest of leveraging health information technology to address health disparities. That's our core mission since 2008. We have led projects around the country since our inception, from hepatitis to precision medicines. We do an annual summit, which we've had delegations from both the Virgin Islands and Puerto Rico every year. One of the big initiatives that we started early on was in the early 2010s when folks were talking about the adoption of electronic health records and getting providers to adopt EHRs. Back then, the ONC coordinator, Dr. Blumenthal, and the director of the Office of Minority Health put out a letter to the vendor community. And that letter said, hey, you folks out there, there's a $30 billion investment that the federal government is doing, but please do not forget the underserved community. Because they were, right? They were not doing the right strategies, the right things to get our underserved community and providers to adopt electronic health records. That effort and that letter led to an initiative that we ran in Houston with the Office of Minority Health and Quest Diagnostics, ONC and others. And the idea was to go into the greater Houston area and get about 75 providers to adopt electronic health records, right? So it was not about the technology, it was all about community engagement, exactly what we're doing here today. And that initiative led to over 300 providers to adopt, and a pipeline over 1,000 providers working with Quest Diagnostics, and it led to recognition from the Mayor of Houston for the work that we did there. And I mention that is because that is in essence why we're here today. You know, the message that we need to take away from today is that it's not the technology, and you'll hear a lot about technology. Well, the message is about community and engaging the community, right? If the community is involved, we could do this. Right after Hurricanes Irma and Maria, we launched the NHIT Care campaign. And that campaign was, the initial idea was, let's get communication in, let's help the community. But this became personal to me, right? Here I was in DC working on these national projects, having access to health information technology. And my family in Puerto Rico were literally dying. On October 30th, I lost my first aunt. On September 30th, I lost my first aunt. On October 12th, I lost my second aunt, my father's mother. And that same night, my mother's sister fell and literally was on the ground. A week, she had to wait a week to get open brain surgery with backup generators. So this became, in the last 2 years, has become what I call a legacy project, but a personal mission. A personal mission to make this thing happen. It's become personal. So we launched the Care campaign. We brought in resources initially through the federally qualified health centers. And that was the initial mission of what we did. Focusing and working with Dr. Donna Christensen, both in Puerto Rico and the Virgin Islands, see what we could do. But in essence, and at the end of the day, what we did with the NHIT Care campaign was initially help with communication, but the last 2 years work on the health information technology and the health innovation for both territories. And that's what we've done. So with that said, I want to stop for a second and just thank everybody that's here today, everybody that participated in the webinars over the summer and the listening sessions, the Department of Interior for funding this summit, both the Department of Human Services and Department of Health for collaborating with us, the dignitaries that we have here today, from the Lieutenant Governor to the Congresswoman to Basil, Congresswoman Plansky. I mean, I really appreciate everyone that's here today. So with that said, thank you so much for being here. And I now want to turn it over to Commissioner Gomez and her leadership for the work that she's been doing.